The one thing that I want every patient to know about cervical cancer is that the majority of it is preventable. So my name is Rebecca Arend, and I'm the Associate Director for Clinical Research in the O'Neill Comprehensive Cancer Center. I'm a GYN oncologist in the Division of Gynecological Oncology in the Department of OBGYN. Most cervical cancer is caused by the HPV virus. If you get the HPV virus, then you can start to have cell turnover in abnormal cells on the outside of your cervix. So the function of the cervix is actually sort of the doorway into the womb that functions when you give birth. Your cervix actually dilates naturally in order for the birth canal to open for babies to be born. Most women get HPV at some point in their lives and can ordinarily clear it. But sometimes the virus can cause precancer, which if you don't excise it or treat it, can ultimately become cervical cancer. So some of the signs and symptoms of cervical cancer can be abnormal bleeding. It can be bleeding with intercourse. It can be abnormal discharge. It can be difficulty with urination. And then as it starts to spread, you can even have decrease in your kidney function and things like that. But I would say the most common thing is abnormal discharge and abnormal bleeding, especially with intercourse. The most important thing is to get your regular pelvic exams. So in GYN, we recommend that even if you're not getting pap smears every year, you should still get pelvic exams every year. Pap smears ordinarily start at the age of 21, and you get them every 3 years until the age of 30. And then you can get them once every 5 years until you turn 65. And you get what we call co-testing. So they take the cells on the outside of the cervix, but they also test for the HPV virus. The way to actually prevent cervical cancer is by using the Gardasil vaccine. And the Gardasil vaccine is recommended for everyone. And it should actually be given, it can be given as young as the age of 9, but usually between 9 and 12 is when kids should get vaccinated. But you can continue to get vaccinated all the way through the age of 45. And it's 3 vaccines, and they prevent you from getting the most high-risk types of HPV virus. We are developing some vaccines that if you acquire HPV, it can help you clear the HPV virus, but the FDA-approved Gardasil vaccine is for cancer prevention. I have 4 kids, all over the age of 12, between 12 and 17, 3 boys and a girl, and all of them have gotten their Gardasil vaccines. If you are diagnosed extremely early with cervical cancer and you want to preserve fertility, you can do what we call as a cold knife conization, where you actually just take the inside of the cervix out, and as long as those margins are negative and it was microscopic, you could still be cured with just a cold knife conization. A simple hysterectomy can sometimes cure cervical cancer as long as it has not gotten to a certain size. Ultimately, if it grows beyond a certain size and it becomes visible, then we do something called a radical hysterectomy, where we take the uterus, the tubes, the cervix, and the tissue around the cervix to try and make sure that we get adequate margins. It definitely is individualized. It matters when you catch it, which is why it's so important to see the doctor every single year. Most cervical cancer, as long as you are getting a pelvic exam once a year, it can be caught early. Most of the time when we have patients who come in with cervical cancer that is beyond a very, very early stage, it's because they actually have not been to the doctor. The one thing that I want every patient to know about cervical cancer is that the majority of it is preventable. So even if you haven't gotten the vaccine, making sure that you talk about the prevention, the preventative vaccine, making sure that your kids get the vaccine is number one. Number 2 is making sure that everybody sees the doctor once a year, and if you're female, that you get pap smears. Also, I think just being aware of anything that is different in your body and whether it's an early sign of cervical cancer, making sure that those signs and symptoms are communicated to your physician. You know, we are the only NCI comprehensive cancer center in Alabama. Any patient with a diagnosis of cancer deserves to have a second opinion or a consultation at an NCI Comprehensive Cancer Center. And part of that is to see whether there is any cutting edge research that is going on or any clinical trials that are only available at NCI Comprehensive Cancer Centers. If you are diagnosed with cancer anywhere in the state of Alabama and you come to UAB for a visit with one of the GYN oncologists, you do not have to stay at UAB for your treatment. If you have cancer, having at least one consultation at an NCI Comprehensive Cancer Center, such as UAB, would be beneficial because then we automatically pre-screen you and give you the information about the clinical trials that we have available.